Good morning, my name is Dr. Jeremy McAnulty from New South Wales Health, and I'm giving you the COVID update for Sunday the 24th of October 2021. There were 296 locally acquired cases of COVID reported in New South Wales in the 24 hours to 8 o'clock last night. In the same period, there were more than 66,000 tests done. Vaccination across New South Wales, we now have 93% of people aged 16 years and over who've had their first dose of COVID vaccine and 84.4% who have had 2 doses. In the 12 to 15 year age group, 77.6% have had their first dose and 48.8% have had 2 doses. We thank everyone for coming forward for getting vaccinated. It helps keep yourself and your community, family and friends safe. In terms of hospitalisations, there are currently 480 people with COVID in hospital, with 119 in intensive care, 67 of whom require ventilation. Of the 119 people in intensive care, 91 are not vaccinated, 18 have had 1 dose of vaccine, and 10 have had 2 doses of vaccine. Sadly, we're reporting the deaths of 4 men today, 2 men in their 60s, 1 man was in his 70s and 1 man in his 80s. 2 men were from Western Sydney and 2 men were from southwestern Sydney. 3 men were not vaccinated and 1 had received 2 doses of COVID vaccine. We'd like to extend our sincere condolences to the family and loved ones and friends of these people who have died. In terms of sewage surveillance, our ongoing sewage surveillance system has detected fragments of the virus that causes COVID-19 in a number of communities. These include Moree, Uralla, Armidale, Trindai and Byron Bay. So everyone in these areas is urged to come forward for testing if they get even the mildest of symptoms. In terms of locations with most cases reported yesterday, these include Lavington, Hamilton South, West Kempsey, Woodbine, Albury, Emu Heights and Busby. Even if you're fully vaccinated, if you get even the mildest of symptoms, please come forward for testing right away. Since the easing of restrictions, we've seen some transmission in indoor venue settings like bars and gyms. So it's important to remember, while vaccine is great, it's not perfect. So it's important that we continue to use COVID-safe behaviours like wearing masks when you're indoors and maintaining hand hygiene and not going out if you're sick. If you get the symptoms, please come forward for getting tested. It's important to come forward for testing early because there are now new treatments available, especially for those people who are highly vulnerable to poor outcomes. And they're best if given early. So it's important to remember there's vaccine, but also treatments for some people who are particularly vulnerable for poor outcomes. Tomorrow, the vast majority of students will be returning to classrooms at school across New South Wales. So it's really important that parents are vigilant for symptoms. In children, symptoms can be particularly mild. So keep a lookout. If your child has any symptoms, please don't send them to school. Please get tested until COVID is excluded. And importantly, if you haven't been vaccinated yet and you're eligible, please come forward and go to one of the many places like GPs or pharmacies or one of our clinics to get vaccinated. The more people we get vaccinated, the better we can manage COVID in the community. Thanks again for all your hard work in the community for getting tested and getting vaccinated and keeping those COVID-safe behaviours to protect us all. Thanks.